Good morning to you all and welcome to the 7th lecture of the 2020 Palliative Care Lecture Series. Hospice New Zealand would like to thank and acknowledge Cancer Research Trust New Zealand for their generous support and funding to deliver these free lectures. The lecture today will be recorded and it will be available on the Hospice New Zealand website. Please note there will be an opportunity for questions at the end of the presentation. There has been a change and unfortunately Linda Hauraki will not be co-presenting today as planned. We would now like to introduce our guest speaker, Ria Earp. Ria currently contracts out her services as an advisory and local manager in social and health services. Ria, please go ahead.
Thank you. Kia ora koutou, tēnā koutou. Ngā kaimahi hauora o te motu I whakarongo ki tēnei kōrero, ka nui te karamihi ki a koutou. Ka mihi aroha hoki, ki ngā hamate kua ngaro ki te pō. Haere atu rā, haere, moi mai rā, moi mai rā, moi mai rā. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Rather than saying next slide, I'm going to be saying huri te rau, which literally means turn the page. So, huri te rau. We acknowledge the depths of the peaceful Southern Alps, the power of the Pacific in the north, the blessings of life from the sunrise in the east, and the beauty of the sunset in the west. We give thanks. Ko rangi nui e tūiho nei, ko papatūnaku I takoto nei, tihei Māori ora. Huri te rau. One of my roles is to help facilitate the annual Kaimahi Hui. Last year this was held in Te Araroa, right at the very top of the east coast of the North Island. And the Hui focused on rural Māori palliative care. Linda Hauraki was one of the Hui speakers and I put forward her name as a presenter with a particular focus on palliative care services in the Tairāwhiti. I think she may, after a few months, stop muttering at me as a result, and it was very unfortunate that she was unable to be with us today. She is flying to Waikato Hospital with her partner, whose surgery date was forwarded and brought forward unexpectedly this week. A quick mention about the next Hui, because I know that some of you are waiting to hear more about this. It was deferred from this year. We were expecting to run it in November, and we now hope to have it operating in early March 2021 in Nelson. So watch, there'll be more coming on that. Ko wai ahau, who am I? He uri ahau o te waka o te aroa, ko Ngāti Pikia, ko Ngāti Whakau e ngā iwi, ko Whakau e te marae, ko te kaituna te aua, ko Ria Earp ahau. Kia ora. Huri te rau. Part of my role in this presentation was to give you a very, very quick overview of Māori population throughout the country, where it's sitting, and then to have that focus put on the Tairāwhiti. So, as we can see in this slide, the Māori population has increased, and the 2018 census highlighted that the population had reached over 775,000. It's sitting at 16.5% of the total population, compared with a European, Pākehā, at 70%, Asian, which of course includes a wide range of ethnicities, sitting at 15%, and Pacifica at 8%. During lockdown, the Aotearoa did reach the 5 million population mark, to validate the Prime Minister's catchphrase, team of 5 million. Puri te rau. So this slide is taken from the 2013 census data and was on the Statistics New Zealand website. I was unable to locate a similar map based on the 2018 census. Some of you will be aware that there were issues with the 2018 census and formulaic calculations were needed and were used to cover the estimated undercount in a number of areas around the country and in parts of the population, including Māori and Pacifica populations. This statistical map, with using the 2013 census, you can see the Māori population spread in various areas of the country. Tairāwhiti, also known as the East Coast, has the highest concentration of Māori population, just under 50%, or 49% to be exact, and has the dark green area. And I know that the map's not very big, but I'm hoping you can still pick up the different shades. Tai Tukaro, or Northland region, is also coloured a slightly darker green. It has just over a third of its population is Māori at 32%. And next in line is Bay of Plenty, with 28% of its population Māori, while Hawke's Bay has 24%. The three South Island, or pale green areas, Wellington and Auckland, have a Māori population in 2013 of about 10% of their total, while the remaining green areas in the north have somewhere between 13 and 21% of their population being Māori. Puri te rau. In considering rural health services, there are common issues regardless of where those rural health areas are, and these are outlined on the slide. Saying this, we need to understand, for example, in the South Island there are vast tracts of rural areas. In the North Island there are areas of rural and pockets of rural areas within the country. However, those rural areas with a significant Māori population have additional issues to deal with. Puri te rau. This slide 7, considers the New Zealand regions and highlights Tairāwhiti. This is the area that is covered by the Tairāwhiti District Health Board, with its very significant Māori population. Although it is the third lowest population in the country out of the DHBs, it therefore has an impact on the funding that the DHB receives. However, it has also some of the highest levels of disadvantage, with 77% of its Māori population in the most disadvantaged or deprived categories. And I think that's a really significant figure that has an enormous impact on the health of the community of Tairāwhiti. Within the Tairāwhiti region, we will focus on the East Coast, and this is a region just north of Gisborne. And as you can see from the slide, we have 75% of the population actually live in Gisborne City. The East Coast has a percentage population of Māori sitting at 85%. There are areas, at least two other areas in the country with a similar sort of profile to Tairāwhiti sub-region, and these include the Eastern Bay of Plenty, just north of Tairāwhiti, and Taitokoro, or the far north of Taitokoro. So the sub-region of the far north, the sub-region of the Eastern Bay of Plenty, and the sub-region, if you like, of the Tairāwhiti, which all have rural, poor and high health needs with their Māori population. Pūritirai. I'm going to switch over to the presentation now that would have been carried out by Linda Hauraki. Ngā mihi mahana ki a koutou. Pūritirai. Ko hikerangi te maunga ko waiapu te awa ko harauta me nukutai nemeha ngā waka. Rua taupari ki tuparo te marae. Te whānau a rua taupari te hapu, ko Ngāti Parau te iwi, ko Linda Hauraki te ingoa, kia ora koutou. Pūritirai. Linda is in this group picture on this slide. She is the fourth from your, moving from your right to your left. And this slide features some of the staff of Hospice Tairāwhiti, including the CE. Kia ora koutou. With 18 staff, the service also has 3 doctors who are working GPs with special interest in the end-of-life care, who between them cover morning shifts. It has community nurses and 2 outreach nurses, including Linda, whose role is to support residential aged care workers and rural communities. While there is no hospice inpatient unit, her Hospice Tairāwhiti does have 2 designated beds at Gisborne Hospital if required. There is on-call 24/7 that can provide advice service for patients or whānau and other health providers, for example, GPs or hospital staff. Hospice Tairāwhiti provides equipment for hospice patients and loan equipment to non-hospice patients. The vision of Hospice Tairāwhiti is to ensure that everyone in their community who is dying and their whānau have access to the best possible end-of-life care and support, from mōrere to kōtaka. Pūritirai. The local iwi for the East Coast is Ngāti Parau. North of Gisborne, the East Coast region, which is remote and beautiful, with its rugged terrain and mountain ranges. It has 2 state highways which link the region with its neighbours. It is one of the most isolated and poor areas of the country, and its mostly Māori residents experience some of the worst health outcomes. As has been raised in Ria's presentation, Māori make up 85% of the population on the East Coast. This is the highest percentage of Māori, the highest density, I guess, of Māori population in any region in Aotearoa. Children make up 30% of the population, which is higher than the national average, resulting in more dependence. The 2006 statistics showed 75% of the East Coast households had less than $50,000 year income. And of interest, the area was probably one of the first hit by the economic impact of COVID-19, with the forestry laying off large numbers of staff along the East Coast. Another area of interest is the fact that the three areas that I mentioned earlier, the far north, the eastern Bay of Plenty, as well as the east coast of the North Island, are all areas where roadblocks were erected to prevent people coming in during COVID-19. Even within this region, there are communities that are more remote from health services. For example, people in Tolaga Bay area live within a short distance to the health centre and are only 45 minutes away from Gisborne, whereas people who live past Hicks Bay may find it more difficult, often over an hour away from the closest clinic and over 3 hours away from Gisborne. The remoteness means difficulty in recruiting health professionals. It also translates as poor cell phone coverage, lack of public transport, and poor roading. Huri te rau. The distance between Gisborne and Pōtaka is 197 kilometres by road, a journey of 2 hours 50 minutes, almost 3 hours. A similar comparison can be made with the journey from Auckland to Tauranga. It's about the same length, however you would have a better time and improved road, and it would take 2 hours 36 minutes, hopefully travelling at the right speed. This remoteness influences access and referrals to palliative services, as well as the quality of palliative care available to whānau or patients. The limited access in general health services for Māori often results in late diagnosis or even eventual referral to palliative services. The further you are away from town, the more disadvantaged people are in accessing specialist services. This also includes access and availability to Tairāwhiti Hospice team. Huri te rau. Bad weather conditions can restrict access to services and are a regular event. These pictures were taken a day after Linda's visit to the coast, and the same weather that impacted on the same storm, I should say, that impacted on Northland and Coromandel are also reflected in this slide. Rural GPs were unable to get to health centres, patients and whānau unable to attend specialist appointments in Gisborne. Without transport assistance, many rural patients would not be able to attend specialist appointments. Other factors that health workers would need to consider is whether the patient or the whānau has a vehicle, is it registered, the availability of a licensed driver, do they have petrol money? Is there petrol available in the community? For example, 2 days before the kaimahi hui talked about on the very first slide, Te Araroa community had no petrol for a week. On Linda's last trip to the coast, both diesel and petrol pumps were out of order in Te Puia. And a classic photo that was taken is also on the slide from Linda's trip. Local communities, however, do have their own resilience and coping strategies. For example, there was a wheelchair van available for private use on a koha basis to whānau to attend functions or appointments. This vehicle is owned by a local business and is part of a sponsorship to Friends for St John's Ruatoria. I also heard of another story of a tangi where the marae was on one side of the slip and the cemetery on the other. So at that point when they were farewelling their loved one, the coffin with the tūpapaku and person was taken to the edge of the slip, then carried across by the men, across to the waiting vehicle on the other side to attend the cemetery service. Huri te rau. Ngāti Pro High Order is the iwi health provider. It's the sole primary health organisation, or PHO, on the coast, and it stretches across that 200 kilometres of coastline. It is an iconic Māori health institution with Te Puia Hospital at its centre. It has a long heritage and a strong community support. It serves all the people on the coast, providing various public, primary and clinical health services. The service has a community hospital, 4 FTE GPs who also work in the hospital, and 6 community health centres. Te Puia Springs Hospital is more akin to a rural cottage hospital, but it may be used for palliative respite, and it can be used for patients who need support with symptom management. Huri te rau. Nursing services provided by Ngāti Pro High Order, and here you can see some of the clinics and some of the key townships along the coast. These are delivered by experienced rural health nurses and practice nurses attached to each of the clinics. The rural health nurses provide a visiting service, including after hours to palliative patients, despite the long distances. Hospice on-call nurse is available for telephone advice 24/7 to support their vital work. Huri te rau. This photo of the Waimoko River Bridge at Whangarā on Highway 35 is 30 minutes from Gisborne and is the boundary where rural health begins. Unfortunately, patients in whānau struggle with this concept. They may come to town to see a GP, but if requiring community services or visits or equipment, they once they cross that bridge, they are in the rural health service area. This can also strain relationships between providers and their communities. So you can see the list of services on the left-hand side compared with the list of services on the right. In 2016, the boost funding increase allowed nursing staff in Hospice Tairāwhiti to have an additional staffing member so that they could have a regular monthly visit on the East Coast. The aim is to strengthen the relationships between hospice patient and whānau, the community and the rural health practice. Huri te rau. This slide graph is data from the 30th June 2019 to the 30th of June 2020. It is the East Coast data, and it looks at the referrals, which make up 16% of the total referrals to Hospice Tairāwhiti. You can see on the left-hand side, the average age is 72. The referrals of the malignant and non-malignant are 52%, 48%, relatively close. The referrals from Tairāwhiti DHB make up 48% of the referrals, with the rest split almost evenly between the GPs, rural health nurses, and the oncology, mostly oncology practice nurses. Out of these referrals from the East Coast, 93% of those referrals are Māori patients. 7% of the referrals are non-Māori. Rural Māori in this area have a shorter life expectancy than urban Māori, with a 1.2 years difference for women and 1.5 years difference for men. Huri te rau. This slide also outlines the contact between Hospice Tairāwhiti and patient whānau from the East Coast. Despite the limitations of monthly scheduled visits along the coast, the hospice does make good use of the opportunities for their patients and whānau when they do come to town to visit, to consider shopping, health appointments with the hospital, or other calls, as well as the telephone calls. And I think there's both a mix in there of both whānau, calls to whānau, as well as to health professionals up the coast. Piri te rau. A dying is a time when the community traditionally gathers to support the family, and these community relationships foster collective resilience. Despite the disadvantage and difficulties of the community, this is both a very strong, culturally strong area of the country, and a community that also considers how it can be resilient with the range of issues it faces. The ability for the community to gather quickly to look at what the needs are for the patient and whānau is important. There is an expectation that whānau will provide the care, how the professionals work together to provide that backup to whānau, or to monitor and consider when the care needs to be shifted to another facility or another place. This also relies on good relationships between providers and the community. Māori people tend to prefer to be cared for by the members of their own community because of their ability to communicate and understand one another. Our specialist support for rural health professionals is also available from Tairāwhiti Hospice 24/7. GPs can call the SMO at Waipuna Hospice in Tauranga for advice. Good anticipatory planning is really important, especially with medication. There is no pharmacy along the coast, and the pharmacy does deliver twice a day, Monday to Friday. So that requires the health professionals to look ahead at what medications are going to be required, especially over the weekend or if there are long stretches between deliveries, for example. Piri te rau. So to touch on what the hospice is currently doing for patients in whānau and primary health, we have this on the strength side. We now have regular monthly visits and more to the coast, 24/7 on-call service. GP has phone access to specialists, strong relationships with other providers, including the NASC, who can operate a palliative pathway to provide resources to patients and whānau. There is equipment based at Te Puia Hospital. The team attends marae-based education programs, update resource information kits for health clinics and hospital, provide education training at Te Puia on symptom management, preemptive breakthrough medication chart, provide debriefs for the rural health nurses, operate a Māori advisory group, which includes the chief executive from Te Puia, and Linda in particular meets with patients or whānau before they return to the coast wherever she can. Weaknesses include the fact that specialist hospice doctors are not the usual process. Minimal equipment is available, so 6 hospital beds, 3 oxygen concentrators, but no delivery van. More nursing staff needed, no kaumātua, no kaiawhina, no social worker, and no inpatient unit. The hospice potential is currently in that process of funding for a new hospice building, and as staff capacity increases, there's always the possibility of increased visits to the coast. During lockdown, the use of video conferencing was more noticeable, particularly between hospice and high-order providers. For whānau, this technology is very dependent on whānau having internet and relevant equipment. Huri tiro. For Māori, there is a strong preference to be reconnected to the land, especially the tribal lands. And in case of the coast, before and for many after death. There is a preference to die at home and to be cared for by the whānau. When we're considering culturally safe practice, we have to remember, it is really the patient and whānau receiving the care that define whether or not they receive culturally safe practice, not those who provide the care. Kai Awhina, Māori health community workers help bridge the gap between health providers and Māori patients in whānau. Cultural identity is very empowering, particularly at the end of life. Described by the newly launched Mauri Mate, Māori Palliative Care Framework for Hospices, available on the Hospice New Zealand website, the whānau are the centre of the Māori world. The whānau will be the main support for the person who is dying, and we need to keep that in front of the work when coordinating care, while at the same time not assuming that cultural practices are all the same. Being Ngāti Porou has shaped Linda's relationship with the East Coast patients and whānau. Their connection is not only through the hospice, but through whakapapa. Uri tiro. Linda has shared with you today through her slides and her preparation the inherent issues in delivering palliative care to a high-needs Māori area. As outlined earlier, this is not the only rural area in the country that the features we've shared today apply to, nor is it the only high-needs Māori rural area in the country. It is perhaps an issue that needs to be considered and recognised at a national level rather than a local level, or maybe as well as a local level. The issues of advocacy, education and partnership are ones that are very strong for Linda, in her view, for how services to a rural Māori community can actually work and improve. We will finish on slide 23, but please note that the references are on page 24 and the final page, 25, is the end of the presentation.